Before you spend another $20, $30, or $40 on fiber powders, probiotic capsules, or constipation supplements, look inside the baking aisle of your supermarket. A small bag of seeds can cost only a few dollars. One daily serving may cost around 30 cents. And unlike many expensive digestive products, it provides real food-based fiber. The seed is ground flaxseed. It may help soften stool, improve regularity, and feed some of the helpful bacteria living in your gut. But used incorrectly, it can also cause bloating or make constipation worse. So the water, the dose, and the timing matter. Constipation becomes more common as we get older. Meals may become smaller. We may drink less because we do not want frequent bathroom visits. We may move less because of knee, hip, or back pain. And many common medicines can slow the bowel. These may include certain pain medicines, iron tablets, antacids, antidepressants, bladder medicines, and some blood pressure treatments. Then the cycle begins. You feel full and uncomfortable. You strain in the bathroom. You buy a fiber powder, then a probiotic, then an herbal laxative. Soon, a simple digestive problem has become another monthly expense. These products are not always useless. Some people genuinely need a carefully selected fiber supplement, laxative, or prescription treatment. But many products are sold with vague promises about gut cleansing and removing waste. Your colon does not need an expensive cleanse. It needs the right amount of fiber, enough fluid, regular movement, and time. Welcome to the channel, where we examine affordable health habits without miracle claims. Today's seed has been used as both food and medicine for thousands of years. The seed is flaxseed, also called linseed. Flax was cultivated in ancient civilizations for both food and linen cloth. Historical records also describe its use as a traditional laxative. Today, we understand more clearly why it may help. Flaxseed contains two main types of fiber. The first is insoluble fiber. This type adds physical bulk to the stool. Think of it like adding soft material to a nearly empty conveyor belt. With more volume, the bowel has something more substantial to move forward. The second is soluble fiber. When soluble fiber meets water, it forms a soft, gel-like substance. This gel can help hold moisture inside the stool. Think of a dry kitchen sponge. Without water, it remains hard and rough. Add water, and it becomes softer, larger, and easier to move. That is one reason water is essential. Ground flaxseed without enough fluid is like placing a dry sponge into an already dry pipe. Instead of helping, it may make the contents thicker and harder to pass. Flaxseed also contains a natural coating called mucilage. When mixed with liquid, this coating becomes slippery and gel-like. That may help stool move more comfortably through the bowel. There may also be an effect on the gut microbiome. Some intestinal bacteria can ferment parts of flaxseed fiber. During this process, they produce compounds called short-chain fatty acids. These compounds help support the cells lining the colon and may influence bowel movement and inflammation. This is sometimes described as a prebiotic effect. A probiotic gives you live microorganisms. A prebiotic gives some of the microorganisms already living in your intestine something to eat. Ground flaxseed is not a probiotic capsule, but its fiber may help create a more supportive environment for certain gut bacteria. Human studies have produced promising but still limited results. In one randomized trial involving adults with functional constipation, both flaxseed flour and lactulose improved bowel habits over 4 weeks. The flaxseed group increased from approximately 2 bowel movements per week to 7. Participants also reported less difficulty passing stool and a better quality of life. But there is an important detail. That study used 50 grams of flaxseed flour per day. That is far more than most beginners should suddenly add to their diet. Another clinical trial involving people with type 2 diabetes and constipation used a smaller amount of flaxseed baked into food and also reported improved constipation symptoms. These studies suggest that flaxseed may help. They do not prove that one spoonful will cure every digestive problem. The form also matters. Whole flax seeds may pass through the digestive system largely intact. Grinding breaks the hard outer shell and makes the fiber easier to mix with food and liquid. Flaxseed oil is different. It contains fat, including a plant omega-3 called alpha-linolenic acid. But flaxseed oil contains little or no fiber. Therefore, it should not be expected to work like ground flaxseed for constipation. And ground flaxseed cannot solve every cause of irregularity. It will not correct a bowel obstruction. It will not treat colon cancer, severe thyroid disease, medication toxicity, or pelvic floor dysfunction. The honest conclusion is this: ground flaxseed may be a useful, inexpensive source of fiber for some adults with mild constipation. But it works best as part of a complete routine, not as a miracle seed. Here is a cautious way to begin. Choose plain ground flaxseed. The ingredient list should say flaxseed or ground flaxseed. Avoid products loaded with sugar, artificial sweeteners, or unnecessary herbal laxatives. Do not begin with a large serving. Start with 1 level teaspoon once a day for 3 or 4 days. Mix it into a moist food. Good choices include oatmeal, yogurt, applesauce, soup, a smoothie, mashed vegetables, or soft cereal. Do not swallow a spoonful of dry flaxseed and then hope it will find enough water later. After eating it, drink a glass of water unless your doctor has placed you on a fluid restriction. If you have heart failure, kidney disease, or another condition that limits fluids, ask your healthcare professional before increasing fiber. If 1 teaspoon causes no significant bloating, pain, or diarrhea, increase to 2 teaspoons per day. After another few days, you may increase to 1 tablespoon per day. For many older adults, this is a reasonable place to remain. Some people use up to 2 tablespoons daily, but there is no need to rush toward the largest dose. Increase slowly. The bowel needs time to adjust. Here is one practical routine. In the morning, add 1 tablespoon of ground flaxseed to warm oatmeal. Mix it thoroughly, then drink water with breakfast, or stir it into plain yogurt with berries. At lunch, you could mix it into lentil soup. At dinner, sprinkle a smaller amount into mashed vegetables or stew. Choose one meal you already eat regularly. Consistency matters more than finding a perfect recipe. Do not expect an immediate result within 30 minutes. Food-based fiber often works gradually. Give the routine several days. During the first week, keep a simple record. Write down how much flaxseed you used. Record how much you drank. Note how often you had a bowel movement, whether you strained, and whether the stool was hard, normal, or loose. The goal is not necessarily to go every single day. Normal bowel frequency differs from person to person. The goal is a stool that passes comfortably without repeated straining. Also support the seed with habits that cost nothing. Walk for 10 to 15 minutes after a meal if you can do so safely. Movement can help stimulate bowel activity. Try sitting on the toilet at a similar time each day, especially after breakfast. Eating activates a natural bowel reflex. Do not ignore the urge to go. When sitting, place your feet on a small stool if it is safe and stable. Raising the knees slightly above the hips may make passing stool easier. Do not sit and strain for long periods. If you take oral medication, do not automatically mix your flaxseed into the same moment as your pills. High-fiber foods may affect how quickly some medicines are absorbed. Ask your pharmacist how much separation is appropriate for your specific prescriptions. Also, speak with your healthcare professional before using flaxseed regularly if you take blood thinners, antiplatelet medicines, diabetes treatment, or several medications. Ground flaxseed can cause gas, bloating, fullness, cramps, or diarrhea, especially when the amount is increased too quickly. Without enough fluid, fiber may worsen constipation. In rare cases, swelling fiber can contribute to an intestinal blockage. Do not use it without medical guidance if you have difficulty swallowing, a known bowel narrowing, a previous intestinal obstruction, severe abdominal swelling, vomiting, or an inability to pass gas. Seek medical advice if constipation is new, persistent, or becoming worse. Also seek assessment if you notice blood in the stool, black stool, unexplained weight loss, anemia, fever, severe abdominal pain, repeated vomiting, or a major change in your normal bowel habits. Always consult your doctor before changing your routine, especially if you are on medication or have a digestive condition. Do not stop a prescribed laxative or other treatment because of this video. The lesson is not that a 30-cent seed replaces every fiber powder, probiotic, or constipation medicine. It is that ground flaxseed may provide real food-based fiber at a fraction of the cost. Have you ever added ground flaxseed to oatmeal, yogurt, or soup? Did it improve your regularity? Or did it cause bloating? Share your experience in the comments below. For more calm, practical, science-based health guidance for adults over 50, consider liking this video and subscribing to the channel. Better digestion rarely begins with an expensive cleanse. It begins with fiber, water, movement, and a routine your body can trust.